Thank you, Jerry. And I want to thank Jane and the organizing committee for inviting me. So this is my second time to Galway. I've been over in March visiting with the Centre for Pain Research because I received the James Flaherty Canada-Ireland Visiting Scholarship. So I'm delighted to talk to you about some work that my lab has done at Sick Kids in Toronto, where we've developed an app called Pain Squad and Pain Squad Plus, which is to help children manage cancer pain. So in terms of my objectives, I want to describe really briefly about how smartphones can be used to promote pain assessment and pain management in the pediatric context within cancer care. I want to talk to you about the phased approach I'm doing in my lab to develop and evaluate apps similar to the slide that Jane showed earlier. I'm going to talk briefly about some lessons learned from our work and then talk about some future directions. So in terms of cancer pain in children, pain is probably one of the most common and distressing symptoms that kids undergoing cancer care face. It can be due to the cancer itself, but more importantly, often it's due to the treatment. And that most adolescents will experience moderate to severe pain at some point during their cancer trajectory. And it really, a lot of care is moving from the hospital setting into the home setting. So that's why we want to focus on a technology-based solution to help young people manage cancer care in their everyday environment, whether that's in the hospital, the home setting, the school setting. And smartphones really provide us with the opportunity to do that. And it helps empower patients to be able to be more active in their own self-care or management of pain. So what we did about 3 years ago is we actually did a scoping review of all the mobile pain apps that were in the stores at that time. And at that time, there were just under 300. And probably most of them provided some self-care advice in terms of support of pain management. About 50% provided education about pain. It's interesting, though, that only about 20% of them actually provided technologies to actually track or monitor pain over time, and very few provided any sort of source of social support. But what was a bit concerning for me as both a clinician and a researcher was the majority of these apps were developed by programmers without any involvement of healthcare professionals in their development. And we could only find one of the 279 that had any evidence that it actually made a difference in terms of pain management. So that led us to develop Pain Squad. And for my PhD work, I had developed one of the first electronic diaries for young people with arthritis. And so we brought together a group of experts in pediatric oncology, pediatric pain, and most importantly, patients. And so I noticed earlier some people hadn't talked about using patients right in the get-go in terms of developing apps, and I think it's really crucial. As I said, we did that scoping review. We then, in terms of working with young people, we had an adolescent advisory group, so young people that had experienced cancer pain to help us to look at building the app. And for Pain Squad, because it was a tool to track pain, we wanted to make sure that it was psychometrically sound, that it had content validity, that it was really measuring cancer pain. We did usability testing where teens took it and used it. We did feasibility testing where they took it home for 2 weeks to look at compliance and technical issues. And then we did the reliability and validity testing, including responsiveness, to make sure that this tool could be used as a tool in clinical trials to evaluate cancer pain treatments. So I just wanted to show you if this works. It's a little video about the app. Oh, it worked before. Let's see.
This is the Hospital for Sick Children in Toronto. Within these walls every single year, thousands of children are battling cancer and are having to undergo terribly painful treatments. Children like Olivia, who 8 months ago was diagnosed with Ewing sarcoma. The hospital is continually trying to minimize this pain, but to do it, they must first understand it better, and most importantly, discover the medications that are working best. To do this, they need these young patients to record exactly how they're feeling in a pain journal. The challenge is that after multiple chemotherapy and radiation treatments, many kids are too tired or discouraged to even hold a pen, much less keep a detailed journal. And the sad reality is that if this data is not collected daily, it's useless. We needed to find a creative solution to collect data every single day, and with the Pain Squad mobile app, that's just what we did. To begin, our patients were enlisted as recruits in Pain Squad, a special police force dedicated to hunting down pain. We gave each recruit an Apple iPhone loaded with the Pain Squad mobile app. Then twice a day, an alert from headquarters told patients it was time to complete their pain reporting mission. Because the reports worked with iPhone's user-friendly touchscreen, kids could easily fill them out. With a simple flick of the finger, they could identify exactly where and how much it hurt, as well as which medications were working best. But making it easy was, well, the easy part. We knew to be truly successful, we needed to find a way to encourage our young target daily. So we called in some police reinforcements.
Hey, rookie. Welcome to Pain Squad. It's really great you're here. We need all the help we can get to help put pain in its place.
We brought together the casts of Canada's top police dramas, Flashpoint and Rookie Blue, and filmed a series of inspiring videos, then deployed them throughout the app. To encourage the kids to fill in their reports, we built in a graduation structure. When a recruit completed 3 reports in a row, they received a message from HQ informing them that they were moving up the ranks.
You are now officially a full-fledged detective in Pain Squad. Well done. At this rate, you might even be the next chief.
Don't stop now. You're almost there.
You truly are one of Pain Squad's best and brightest. Keep it up.
Back inside the precinct, recruits could check to see when to fill out their reports and how many badges they had earned. And once their last report was filed, they were sent one final message informing them that they were being retired from the field.
But this case isn't closed yet. Your squad is still fighting. We couldn't have done it without you. So way to go.
The app is an excellent tool. That's her control over the pain because she's able to document it herself, but she's using an app. She just glides right through it and it makes her feel that she's a part of this. It's fantastic that you all were able to come up with this. It really helps.
Just got the word from Chief. Turns out you've been doing so great, he feels like you're ready to move up. You're well on your way to putting pain in its place. Don't stop now. You're almost there.
Congratulations. Sergeant.
So Pain Squad app is freely available in the Apple Store. And I just want to mention briefly that concept of gamification because we were really concerned about young people undergoing cancer care, feeling really crappy and not wanting to complete the reports. So this concept of gamification with these little video rewards that they got actually really improved compliance. So over a 2-week period, asking them to do it twice a day, we had just under 90% compliance, which I think is actually pretty awesome. This is the data from that psychometric testing study where just under 100 kids completed the diary for a 2-week period. And just showing you the data, you can see that they actually are experiencing pain on most of the entries. And it did ask them about what sort of strategies they're using to manage their pain. And this is the data that led us to develop Pain Squad Plus because despite being prescribed medications, these kids aren't using their pain medications. And more importantly, they're not using non-pharmacological, so psychological and physical strategies that we know work in terms of managing their pain. So it was talked about this morning as well, I think David talked about this, the importance of using theoretical frameworks to guide your interventions. And so this is an adaptation of the health behaviors model by Emily Cito, using it within the context of using real-time technologies to change behaviors. And unfortunately, I don't have a laser pointer. But you can see, looking at some of the mediators in terms of trying to improve things like self-efficacy. So that's one of the things we're focusing on in this app that we've created. So Pain Squad Plus was created actually by a doctoral student in my lab, Lindsay Jibb. So it does the 2 assessments per day, and it does ad hoc assessments as well. Then based on those assessments, it actually provides advice based on a rules-based algorithm that we developed, and that was by bringing in clinicians again and patients. We did interviews with adolescents with cancer, their parents, and healthcare providers, and the healthcare providers were actually very adamant that they wanted a nurse alert support system in here because poorly managed cancer pain is an urgent event where a lot of these kids would come to the hospital. So we built that feature in, and then once we push advice to the teens, then within an hour it asks them how that advice was used and did it help with the pain. And again, we built in the gamification, but this time we're rewarding them for using the advice rather than completing the pain assessments. So the approach, again, we used in our lab is a phased approach. Using a user-centered design. And so Lindsay did a systematic review of evidence looking at physical and psychological cancer pain strategies. We had a consensus conference where, again, we brought in the clinical experts in oncology, pain, patients, and mobile app developers to inform the algorithm and then vet that algorithm with patients and families and clinicians. We did usability testing and pilot testing, and I'll quickly show you some of that data. So the usability testing was really focusing on, is this app easy to use? Do kids understand it? Is it quick to complete? And is it acceptable? And so we usually do this in iterative cycles with about 5 to 7 patients. And again, this was in one center, so at Sick Kids, again, looking at adolescents with cancer on cancer treatment. So again, this is the study design where they come in, we collect a bit of data from them at the beginning, we ask them to use the prototype and talk aloud, and then we will make refinements based on that. So these are the 3 cycles. You can see we had 4 to 6 patients in each cycle, and a good split between males and females and across the cancer diagnoses. So this is the analysis, and you can see throughout the cycles until the 3rd, we did have changes in terms of trying to improve ease of use. So there were some technical issues that had to be fixed. There was some confusion with placements of the body map in terms of kids wanting to be able to access where their port is. There was a bit of confusion around some of the words, so we changed that. There were no issues related to the efficiency. None related to the app design. Again, there were a few things related to wording and navigation, but otherwise the teens found it very acceptable to use. We then went on to do a pilot study to determine the sort of implementation of this and also to look at estimates of treatment effect. And this was a one-arm, just pre-post study design. Again, using the same participants, but this time they had to have self-reported pain of at least 3 or greater in the past week. This is the study schema. So we brought them in, we collected some baseline information and outcome measures. They used the app for 28 days. We then did post measures on them, and we also interviewed 20 of the 40 teens that were participated in this trial to get more qualitative feedback about their experience. So these were the outcomes that we were looking at in terms of, can we recruit teens? Do they withdraw? Treatment fidelity in terms of the nurse alerts and her ability to contact the patients, looking at the proportion of kids that complete the outcomes before and after, their adherence to the app, so compliance, acceptability, and then what is the impact of this app on things like pain intensity, pain interference, pain-related or health-related quality of life, and pain self-efficacy. So the mean age was about 14. Again, we had a nice split between males and females and across the cancer diagnosis. This is just the recruitment, showing that it took us about sort of 6 to 8 months to recruit the sample from 2 centers in Canada. So there was some technical issues that occurred with 6 participants, mainly related to some hospital server issues. And one participant, because we actually gave the participant's phone, and one participant went out of country during the treatment period, and we had no roaming data options. In terms of the nurse alerts, so 13 of the 40 patients actually generated 29 alerts to the nurse. And unfortunately in this trial, we really didn't have a lot of money for the nurse alerts, because that wasn't something we had factored in at the beginning. And so we had someone working who was a full-time oncology nurse, but working 0.2 for us. And you can see it took her quite a while, so 62 hours to get back to the teens. One of that issue was that the teens, we gave them a study phone, and most teens had their own phone and said that was one of the issues. The nurse was trying to call them on the study phone versus their phone. And then the nurse had to contact the primary health care provider in 4 instances because of severe pain. So you can see that the majority of teens we had good compliance with completing outcome measures, both pre and post, and you can see that there was high adherence with using the intervention with a mean of 27 days of data. So this is the this is the E-acceptability scale. So this is a scale that's validated to look at acceptability of, it was originally developed for online interventions, and we modified it for the app. And you can see for most of them, this is a score of 0 to 5, and you can see that people thought it was easy, the questions were easy to understand, it was helpful in describing their pain. They were satisfied with it, but there were a few sections where the teens thought were something we could improve, and one of them was the time to complete the app. So I think Sean and a few other people talked about how important it is to really have the minimal number of items that you really need. So that's something we're working on. And then again, we did those qualitative interviews to again really explore in more detail about the acceptability of the intervention. The teens talked about, we had, I think, 250 pieces of individual advice we could push to them, and they were saying we want even more advice in the app. They really liked the intervention. They did provide some recommendations for improvement. This is one quote from a 16-year-old female. I thought the pain ideas were really awesome. They had some pain ideas where they would suggest like relaxation and breathing and how to do that, and you would click on it and someone would talk to you. So we had guided imagery and meditation clips within the app. And so what's really promising to me is we actually have preliminary evidence that this app is actually reducing cancer pain. So you can see that the effect size for worst pain, least pain, and average pain are all significantly lower post-intervention. And also we have reductions in emotional and social functioning, or improvements in emotional and social functioning in terms of health-related quality of life. And there is evidence again that the app reduces pain interference, which was measured by the PROMIS, and that although it's not significant, there is an increase in self-efficacy related to pain care. So in terms of lessons learned, I think it's really crucial that we involve end users, so whether they're kids with cancer, whoever, to be actively involved in all stages of development and evaluation of mobile apps. I think, as a few people have said, we need to use the KISS principle. We need to really keep it simple. And so we actually have a study now where we're refining the questions. So right now there's 16 questions, and we're going to really try and look at the data to see which questions are really driving them using the advice. Moving forward, we're actually using teens' own devices. They don't want to be given an extra device that they have to worry about or carry around. And then we are going to look at doing a study with and without the nurse support, because with the nurse support in there, it would be classified as a Class 2 medical device, which would mean that we would have to license this to institutions, which would affect the adoption of this app. And I think one thing that I'd love to hear discussion today is what are the best study designs to be evaluating these apps given the rapid pace of technology. I don't think RCTs are the designs that we should be using. I think we have to look more to implementation science, but maybe that's something we can have a discussion about. So in terms of future research, we're looking at doing a full-scale study to evaluate the app with and without the RN support. And I think we need to, if we're going to keep the RN support in there, look at the cost effectiveness of these interventions in terms of does that support reduce ER visits, etc. We are looking at adding other symptoms to the app in terms of fatigue and nausea, and again, that was feedback by the young people. But in closing, I think the successful development of smartphone pain self-management system has the potential, and I think I've shown you some data, to improve pain-related outcomes for adolescents and minimize some of the barriers that they currently face to receiving these sort of treatments, and it can have an impact on their quality of life. So I just want to acknowledge this is Dr. Gibbs. She defended her PhD, and this is most of her work last month, and the adolescents with cancer and healthcare providers that participated in the study and the various funding sources that we've received. So thank you.